The reality is public health is among the most altruistic professions in the world. But when we're stressed, we might have very altruistic intentions, unbiased intentions, but our actual actions may be less so. But we can take steps to identify and reduce our implicit bias. And we must do that if we're going to reduce health inequities in this country and increase parity within our field. And so what I want to offer you are 8 tactics that have been adapted from an article written by the American Association of Family Physicians. And these 8 tactics form the acronym Implicit. Introspection, mindfulness, perspective taking, learn to slow down, individuation, check your messaging, institutionalize fairness, and take 2. And we'll explore each of these briefly in turn. Introspection. Explore and identify your own biases by taking an implicit association test. The Harvard Implicit Association Test is an excellent, easily accessible tool for this introspective work. Mindfulness. Find ways to reduce stress and increase your mindfulness. P is about taking perspective. Consider experiences from the point of view of the person being stereotyped, from their lived experiences. You can do this by reading or watching content that discusses those experiences without or directly interacting with people from those groups. The L is about learning to slow down. Before interacting with people from groups where you may have an implicit, socially conditioned bias, take a minute to pause, reflect, so that you can reduce reflective actions and microaggressive communication. The I is all about individuation. Evaluate individuals based on their personal characteristics, rather than those that you assume to be affiliated with their group. The C is about checking your messaging. Rather than saying things like, "we don't see color," use statements that recognize, welcome, and embrace diversity in the lived experiences of historically marginalized groups. The I is about institutionalizing fairness and building cultures of belonging, where everyone across the spectrum of diversity feels psychological safety that allows them to call out microaggressions and call in colleagues who may not recognize the impact of what they're saying or doing. Institutionalizing fairness within the profession is necessary to bring force and action to the increasing number of pronouncements that racism is a public health crisis and to actually reduce the racial health equity gap in this country. The T is about taking 2. Reducing and resisting implicit bias is lifelong work. You're necessarily going to hit some bumps along the road, but continue to move forward. This is individual and institutional work. And know that you can, and sometimes you must, restart the process. Look for new ways to learn about new people and new cultures, and learn about ways to resist the temptation to lean into your negative bias. I challenge each of you to use the 8 tactics and do the work to identify and reduce your individual negative biases. This is an important first step toward reducing the racial health equity gap, improving health disparities, increasing parity within the field, and better health outcomes for all. Thank you.